Why does cancer never go away on its own? Because rapidly replicating cancerous cells are seen by the immune system as part of the body rather than a threat. However, there is a category of treatments called immunotherapy that seeks to enable the immune system to recognize cancerous cells and attack them. For advanced kidney cancer, where tumors originate in the kidney before spreading throughout the rest of the body, several immunotherapy treatments may be used. Some of these treatments may inhibit or stop biological pathways that cause rapid cancer cell replication. The American Cancer Society recognizes these treatments as checkpoint inhibitors, so named because they activate or deactivate proteins on immune cells called checkpoints that may then trigger an immune response against cancerous cells. Another treatment recognized by the American Cancer Society uses cytokines, or proteins that boost the immune system. According to the Cancer Research Institute, there are currently 6 FDA-approved immunotherapy treatments for advanced kidney cancer. 4 of these treatments are checkpoint inhibitors. One of these treatments uses cytokines, and another one of these treatments uses a combination of 2 checkpoint inhibitor drugs. Some immunotherapy drugs, like in the last case, can be combined, such as drugs nivolumab and ipilimumab, which lead to better survival in cancer patients than a targeted therapy drug called sunitinib. Now, targeted therapy is not the same as immunotherapy, but drugs from both categories are often combined to lead to better results in cancer patients. The Cancer Research Institute recognizes this combination of 2 categories as systemic treatment. Now, there are 2 trials cited by the National Cancer Institute in which tests for these systemic treatments were done on cancer patients. One of these trials used a combination of the targeted therapy drug exenatib and an immunotherapy drug avelumab. The other trial used exenatib and a different immunotherapy drug called pembrolizumab. Both of these combinations led to better survival in cancer patients without worsening the disease at all, compared to the targeted therapy drug sunitinib. I'd say that's fairly effective. Now, according to the Cancer Research Institute, cytokines only shrink the cancer in about 10 to 20% of patients treated this way. I'd say that's fairly ineffective. For all immunotherapy treatments, no matter how effective or ineffective they are, side effects may result. The American Cancer Society lists some mild symptoms of checkpoint inhibitors being fatigue, diarrhea, skin rash, cough, joint pain, and shortness of breath. Now, some more serious side effects, or symptoms of side effects, occur less often for checkpoint inhibitors, but they occur when the immune system attacks parts of the body that are not cancerous. That can be fairly devastating in some cases, and even life-threatening. The National Cancer Institute cites some symptoms from the 2 trials of systemic therapy, being most commonly high blood pressure and diarrhea. Finally, cytokines have a higher risk of serious side effects, as mentioned by the Cancer Research Institute, as well as flu-like symptoms and extreme fatigue, as mentioned by the American Cancer Society. That's fairly riskier than being treated by checkpoint inhibitors or systemic treatments. So, to review, checkpoint inhibitors, which function by interfering with pathways enabling cell replication, as well as attacking cancerous cells via the immune system, tend to be more effective than cytokines, regardless of whether the inhibitors are used individually or in combined treatments. Cytokines, while being less effective, also have a higher risk of serious side effects.